Country and different counties are sounding the alarm bells of hospitals being overwhelmed and no ICU beds being available. Now, the third wave, health experts say, is rapidly escalating, with community spread extending outside of Nairobi. 747 more people tested positive and 17 more deaths have been recorded. And as Dorcas Wangira reports, church leaders are calling on Kenyans to maintain personal discipline in a public crisis.
Kenya is becoming a red country. Health experts continue to warn as the country battles rising contagion numbers of the third wave. In just 24 hours, 747 people have tested positive from 5,145 samples, bringing the cumulative cases to 120,910, with a test positivity rate at 14.5%. Similarly, 17 deaths have been recorded, 7 having occurred in the last 48 hours, while 10 are late death reports from facility record audits that have occurred on diverse dates, bringing Kenya's cumulative fatalities to 2,011. 889 patients have been admitted in various health facilities countrywide. 2,545 patients are on home-based isolation and care. 121 patients are in the ICU, 32 of whom are on ventilatory support and 86 on supplemental oxygen. Another 59 patients are separately on supplementary oxygen, with 41 in the general wards. 18 are in the high dependency unit. With the third wave, according to Dr. Ahmed Kalebi, and I quote, having officially surpassed the first wave and continuing to rapidly escalate, with intensification of community spread extending outside Nairobi, which means the third wave may peak higher than the second wave with deadly consequences, alarm bells should be ringing, end of quote. He further adds, and I quote, dear Nairobians, this is the very worst time to get COVID-19. If you fall seriously ill in need of a hospital bed with oxygen or an ICU bed, you won't find any in the city. Hospitals are overwhelmed, so please take extra precautions to keep yourself safe from contracting the virus, end of quote. Machakos Governor Dr. Alfred Mutu also tweeted, and I quote, the ICUs in Machakos County are full with both Machakos and other county COVID-19 patients. Currently, there are no ICU beds available. If you see someone not wearing a mask, question the intention. Your life is yours, not corporate, end of quote. Dr. Thuranira Koigure also weighed in on the conversation, and I quote, if Kenyans narrated the horror stories on what they have gone through trying to secure an ICU bed for their COVID-19 relatives in the last 2 weeks, we would all reform. I am just heartbroken, too painful. We need to overcome COVID-19. What happened to our ambitious plan of 300 beds per county? Sad state of healthcare, end of quote. Beyond Nairobi, the county's preparedness to deal with the rising number of COVID-19 cases, hospitalizations and deaths is a point of concern. According to the Secretariat National Isolation and Quarantine Facilities, with regard to the current status of COVID-19 isolation and ICU beds, there are 353 health facilities, 827 ICU beds, and 20,910 isolation beds. But in spite of the vicious nature of the third wave, for many Kenyans, life continues to pulse as normal. At the AIC Nakurtakwe Church in Eldama Ravine, Baringo, the church service is held without observing all the guidelines laid down by the Interfaith Council and the Ministry of Health. It is a similar situation at the ACK Christ Church in Kaloleni Voi, where the church space is too small to accommodate all the worshippers and still observe the containment measures.
Kwa vile watoto wamefunga na wako nyumbani, then kucontrol population inaweza kuwa challenge. So kile ambacho tunaweza labda kufanya ni we can create more services, maybe to create service ya jioni kwa mfano, maybe for the youth.
Sisi kama kanisa about mambo ya COVID.
The clergy insists that the church is not the weakest link in the fight against COVID-19, but the lack of personal and individual discipline. Others calling for more stringent guidelines.
We are in a generation, Bishop, where the society is online and the future is online, and therefore feasibility online and accessibility online is inevitable for the church to extend her mission and continue to thrive.
When you are speaking to the microphone, don't remove your mask. Keep your mask well. on. It is true you might not be heard well, but keep your masks on. This is our protection. We are insisting so that our places of worship our churches become safe, and that our families become safe.
But other churches, for instance the Apostolic Faith Church and the Pefa South Sea Church, are observing the guidelines and taking precaution.
Problem iko kwa kanisa, hapa space ni kubwa. Problem iko kwa social life. Hata mimi niruhusiwa na ibada ya watu 10,000, bora niweke social distance. Na huku hewa ni kubwa. Problem si churches meeting. A social life on daily basis.
It's a serious thing. We need to take the precautions as the government is directing us. Washing our hands, sanitizing, putting on the mask, especially whenever you are in congregation. Like here in the church, before they enter, they have to be in mask.
Experts are calling for more risk messaging and enforcement, particularly in the counties with a high population of the elderly and whose hospitals are more likely to be overwhelmed and have a limited capacity for intensive care and high dependency treatment. Dorcas Wangira, Citizen TV.